Okay, so tissue response to injury. So every time we get hurt, there's certain physiological events that happen throughout the healing process to have healing happen. So there's 3 phases. So our whole goal is to create an environment that will best correspond to these healing processes and get them to heal as quickly as possible. If we have the ideal environment, it's your best case scenario to heal. The healing process is also on a continuum, so I want to think of it in a circular manner. So phases are going to overlap and have no definitive beginning or end point. So it's not like on day 5 it's this phase and on day 6 it's the other phase. It is a continuous process. So like I said, there's 3 phases. There's the inflammatory phase, the fibroblastic or proliferation phase, and the maturation or remodeling phase. So this is kind of a chart of what I'm talking about, so see how there's overlap. So the first phase, the inflammation phase, or inflammatory phase, approximately 4 to 6 days. The proliferation phase, about 4 to 24 days. And remodeling, 21 to 2 years. Now this is dependent on the wound, the injury, and the injury part. Like, are we talking bone? Are we talking muscle? Are we talking ligament? Like, different pieces heal at different times. Now, phase 1 for an inflammatory phase, we've got begins almost right away, and it traditionally lasts about 2 to 4 days. Our goals during this phase is to protect, localize, keep it in one spot, and decrease any other injuries, and prepare for the healing and repair. So it begins immediately, and once a tissue is injured, it's going to kind of almost call and have the inflammatory response happen, just like you've always seen in bio. If a sickness happens, it recruits more white blood cells. It's the same concept. And so this injury to the cellular level creates an altered metabolism and releases chemical mediators that cause the inflammatory response. So we have to have inflammation to heal, like we talked about the great ice debate. We have to have it, but we also don't want it to be prolonged, and we also want it to be done and over with. So signs of inflammation. So this is redness, heat, swelling, pain, loss of function due to this. So when you hear redness or what's called rubor, that's basically it's red. Heat is a sign of inflammation, so increase in skin temperature, and pain is normally used by, sensation or touch. Acute inflammatory response. Okay, so there's cellular changes like I mentioned. So it's a chemical reaction. It starts right away. Then we've got the chemical mediators that cause vasoconstriction and vasodilation. So it's histamines are released from an injured cell that cause the vasodilation. And then the cytokines help attract more phagocytes to the inflammation and that allow for the healing and then constriction. So vasoconstriction caused by histamines immediately, vasodilation, I said that backwards, I'm sorry. This is vasodilation happens, and then it's caused by the histamines, okay? And this is vasodilation, the increase, the swelling, okay? Now these proteins are then brought in to do building blocks, and it neutralizes and destroys the offending agents and restricts the tissue damage to the smallest possible area. So you want it to happen, okay? So we need this to happen. So phase 2, fibroblastic phase. So the proliferation phase. This can be from 48 hours to 3 to 6 weeks, depending, or even 4 to 6 weeks, depending on it. It's where scar formation happens, and it's going to begin right away in the first few days. A scar is a temporary repair, okay? So when you think of like a scab healing, that scab is that temporary, that first step. That's what we're talking about, the fibroblastic phase. And it's dependent on levels of skin cell production and production of fibroblasts. So also it can have pain. If there's pain and movement and stress is put on it, this can take longer to heal because you build a little building block, but if it's not quite strong enough and you stretch it too much, then it breaks and has to start over again. So the complaints of tenderness and usually gradually disappears in pain as throughout this phase. So There's 3 phases throughout this within one phase. So resolution, so it's when the dead cells and cellular debris are removed, and then the tissue's left with the original structure and the function is intact. So think about when you have a scab, once the scab falls off, your new skin is laid down just like before. So this is basically the process of that. And also during this process, you might have some redness or inflammation as well. Also, there's regeneration. So now we're fixing the damaged tissue and replacing the damaged tissue with the same type and structure, okay? And having a collagen or fencing. So this is where they kind of blend back together. So they make the extracellular matrix that contains the protein and collagen and elastin, not elasticon, that's a type of tape, elastin that is going to build the structures back to how it was. And about the 6th or 7th day, the fibroblasts start to begin to produce these collagen fibers that start forming the scar. And then repair, the original tissue is replaced with this scar tissue and tissue alignment. So we want to think like 80 to 90% of collagen in the body is type 1, type 2, type 3. So when we talk about that, we're talking about type 1 is like the skin, fascia, tendon, bone, ligament. Type 2 is the hyaline cartilage or the vertebral discs. Type 3 is more skin, smooth muscle, nerves, and blood vessels. Now type 3 is not as strong as type 1, so you just have to keep that in mind. So in phase 3, now we've got maturation and remodeling. So this traditionally is about at the 3-week mark, and it's where we try to increase the strength of the repaired tissue. So the tissue is now fixed, the tissue is there, but it's not strong. It's baby tissue, brand new tissue. So we got it's a long-term process, and it's realignment and remodeling of the collagen fibers, and we're trying to get them to be as strong as the other ones were. We want to increase the stress and the strain to cause this to get better and also get stronger. So this is why it takes 3 months to several years depending on the situation. And balance has to be maintained between the synthesis and lysis. So the synthesis is the build up, the strengthening of it, and the breakdown is when anytime you strengthen something in the process, sometimes it breaks down in that process. So you have to constantly have a balance in that. You can't do all build up and no breakdown, or all breakdown and no build up, otherwise you'll go backwards into the phase. Phase 3, remodeling, taking consideration forces applied. So remember immobilization time frame and healing time frame. So depending on the tissue, depending on the structure, depending on the needs, you have to remember what happened and how it happened and what it was happened and how you can best adapt to it. So if you're immobilized, you're going to have a lot of muscle death, not necessarily the injury spot, but around it because you haven't used it. Scars eventually fade and then they return to normal color. So soft tissue healing. So there's different variances in modifying soft tissue healing. Obviously everyone wants to get back as quickly as humanly possible. And our goal with this is to get them back as quickly as possible. So to do that, we want to make sure that there's the necessary blood supply and the necessary nutrients. Healing in older athletes take longer, or those with poorer diets take longer because they don't have the proper blood supply and nutrients. That's why you probably hear of your mom and dad saying, I used to sprain my ankle and be back in a day, and now I sprain my ankle and it takes me weeks to get back. So the older the athlete, the longer it takes to heal. Also, you want to take in consideration diet. There's also some type of blood disorders that can cause or inhibit the healing process. And you want to provide controlled mobility. Remember, we talked about this for injuries and injury treatment. So we want to have movement, but you want to make sure it's controlled and that you know what they're doing and how much of that they're doing. And it's called Wolff's Law. So Wolff's Law is the concept that bone and soft tissue respond to physical demands and cause remodeling and realigning and increasing tensile force. Meaning we are giving them force, putting force upon it, strengthening. Think strength training. So strength training is all Wolff's Law. So you want to do strength training as much as you can, and in that process there's going to be some breakdown of the tissue because you're breaking down the tissue. The soreness is breaking down tissue. However, when you break it down, it therefore then builds back up and it builds up stronger. So Wolff's Law is the concept that as stronger things are applied at a controlled rate and in controlled situations, it's called a good stress. So we're stressing it to make it stronger. You can't make something stronger by lifting the same 2-pound weight for your whole life. You have to steadily increase that 2-pound weight. Factors that can impede healing. So there's things that can slow down healing. So extent of injury. So depending on what the injury is or how bad the injury is, obviously that can determine the length of healing time. Now, when we talk about that's micro tears versus macro tears, micro tears are overuse injuries. They're very small, minute tears. Those are called minor damages. It's maybe sometimes part of soreness or sometimes injury. Macro tears, it's greater destruction of the soft tissue and clinical symptoms, meaning functional altercations, meaning limping or unable to move something. So that's when something's completely torn. Edema. So edema is swelling. So the increased pressure put on tissues impedes healing processes and decreases the nutrients to that area and neuromuscular control. But this is why we want to control the edema. But we also need the edema, like we talked about, for the inflammatory phase. Now we've got hemorrhage. So depending on the amount of bleeding due to damage can increase healing time. Or if there's poor vascular supply. So if there's no vascular supply to the area or very poor, it's going to take longer to heal because it can't get the nutrients or fibroblasts or the different cells to the area to get ready for healing. Also, muscle spasms. So prevents approximation, so basically aligning close. So when we think of a muscle spasm, think of a cramp, okay? And during a cramp, it's called ischemia, so there's a decreased blood supply. So muscle spasms can impede healing. Atrophy, it's the wasting away of tissue. So if you are in a cast, if anyone's ever been in a cast, when they took the cast off, that arm or leg is significantly smaller than the other arm and leg because that muscle hasn't been used for 4 to 6 weeks or 6 to 8 weeks, and that muscle is significantly smaller and has to be built back up to the other side. Infection can impede healing because your body is now focused on dealing with the infection instead of healing, and bacteria is basically caused by bacteria and can cause large scars. And health, age, and nutrition. So like I previously mentioned, if you're older, it takes longer to heal. If you have degenerative diseases, it takes longer to heal. If you have decreased nutrition or a clotting factor, these are all situations that can cause impeding healing. Now, how different tissues heal. So cartilage has a very limited capacity to heal. So it's a full thickness tear, takes about 2 to 6 months, and sometimes requires surgery. And this is because there's little to no blood supply. Think about when you pierce your ears, that's your cartilage. There's not a lot of blood involved. There's no blood supply. So that's why it heals very slowly. A ligament or tendon. So this is traditionally about a full healing. It could be up to 12 months. There's a decent blood supply. But a strong pull on a tendon, you can't work on it or work with it for about 4 to 5 weeks to get it strong again. Ligaments, it really depends on the amount of pull or the amount of injury. Sometimes it can be hours to a week for the inflammatory response, 10 days to 6 weeks for proliferation, or 8 to even 50 weeks for remodeling. So you want to make sure that they're completely healed before you start stressing too many of the tissues. And you want to keep this in mind when you're working with someone, knowing what body part is injured and what stage they are most likely in. Skeletal muscle healing. So initially, this is if you pull a muscle or injure a muscle, the initial bleeding is followed by laying down of ground substance and healing the tissue, just like we talked about. But it could last up to 6 to 8 weeks depending on it. So inflammation is about 6 hours to 1 week. It's a little bit shorter than ligaments and tendons. Proliferation is 1 week to 18 days, and remodeling 6 weeks to 6 months, depending. So the shortest healing time is skeletal muscle, then ligaments and tendons, and then cartilage. Bone healing. So inflammation, it's minutes to days. Fibroblasts and macrophages need to come in. Proliferation, it's 4 days to 6 weeks. And remodeling, 6 to 12. So that's why when you break a bone, it's a 6 to 8 weeks pretty much no matter what. 4 weeks, there's a hard callus forming that bridges. So depending on the severity of the fracture or the location of the fracture, sometimes 4 weeks you can get a cast off. But most of the time it's around that 6 to 8 week mark. And that's why it's always the same. We know it takes that long. And the bone structure is the only structure that when it is healed completely, it's back to 100% pre-injury strength. When we talk about skeletal muscle, most likely it's only about 90% normal at 6 months. And we never quite get back in the other tissues. So this is why it's important to control swelling, because if we get too much swelling in the initial phase, we can almost get stuck in the inflammatory phase and slow down the healing process. That's why we want to limit the amount of swelling using the Price principle, like we discussed earlier. Important, remember, protect the injury from further damage. You want to splint or immobilize the injured site and potentially allow for crutches. And then we want to have restricted activity. You know, it says rest most of the time, but I like to use restricted activity because I want them to begin healing after the injury, and I want them to have the mobility and increased mobility because it has been proven to be superior to immobilization. However, you want it controlled, and you want it, you know, maybe if it's an ankle, we're talking about doing circles with their foot. We're not talking about walking initially. There's baby steps. Now, compression, now this is one of the single most important factors in controlling swelling because there's just not space for the swelling to go. So when we have an elastic wrapped around, firm and evenly applied, then that's going to allow for control of swelling. And then compression can be maintained for about 72 hours. So we want to make sure that we have these on as best as possible and kept on, but also we want to make sure that they're not on too tight so that they cut off circulation. We don't want that either. So whenever you put on a compression wrap, you always want to check for circulation in the distal body parts. Elevation, we want to use to eliminate the effects of gravity and blood pooling and help with the venous and drainage system and decrease the swelling. So as often as possible in the first 72 hours of an injury is ideal. Now, when we're going to be dealing with a pre-surgical situation, there's slight differences, but not much. So if there's a situation where the surgery is delayed for any type of reason, prior to surgery, you want to work on strengthening and full range of motion, because if the better they go into surgery, the better they'll come out of surgery, is what we want to think about. Okay, so if they're going into surgery, we want to make sure they're doing some exercises to help improve their outcome. So, rehab phases. So how does these healing processes affect what I'm doing in rehab? So phase 1, we got acute inflammatory phase. So what am I focusing on? I'm focusing on decreasing inflammation and increasing mobility. On phase 2, I'm focusing on mobility, proprioception, and beginning resistance exercises. Phase 3, I'm increasing the resistance exercises. I'm talking about endurance exercises, and I'm doing sport-specific exercises. So, a little more in detail. So phase 1, this is when we do Price. We want to make sure that we allow for some of the inflammation to happen, but have mobility and a gradual increase of weight-bearing status and using of NSAIDs, so non-steroidal anti-inflammatory drugs. Phase 2, now we get a little bit more exciting in the rehab. Now we're talking about cardiorespiratory fitness, restoring full range of motion, start doing some slight range of motion and strengthening exercises, and reestablish that neuromuscular control. We can use modalities for pain control at this point. And then phase 3, this is the longest phase, but this is when we're working on return to activity, more sport specific. We're using different functional activities when the exercises look more similar to the actual sports and activities they're doing. We're going to do functional testing during this time to figure out where their weaknesses are and adjust their rehab protocols and rehab exercises to those weaknesses. Pain management is a big thing. We always want to reduce pain. We want to control pain. We want to know about the pain, but we don't need the athlete or patient in that much pain because pain equates to further damage and potentially not healing processes going on. So you want to have a good physiological interaction, so positive thinking. We can use medication. We want to have good communication. We want to use modalities to reduce pain, anything that'll work to help maintain the pain.